Snakebite Overview. 2 types of snakebite: 1. Venomous, 2. Non-venomous. The major categories include: cytotoxins, cause swelling and tissue damage wherever you've been bitten. And one is more serious than the other, dry bites. These occur when a snake doesn't release any venom with its bite. As you'd expect, these are mostly seen with non-venomous snakes. These occur when a snake doesn't release any venom with its bite. As you'd expect, these are mostly seen with non-venomous snakes. Venomous bites, these are much more dangerous. They occur when a snake transmits venom during a bite. Poisonous snakes voluntarily emit venom when they bite. They can control the amount of venom they discharge, and 50 to 70% of venomous snake bites result in envenoming or poisoning. Even with a less serious type of bite, every snake bite should be treated as a medical emergency, unless you're absolutely sure that the bite came from a non-venomous snake. Any delay in treatment following a venomous snake bite could result in serious injury or, in the worst-case scenario, death. It's estimated that at least 81,000 to 138,000 people die each year from snake bites. Even so, it is best to treat all snake bites as a medical emergency unless one is certain the bite came from a non-venomous snake. Any delay in treatment following the bite of a venomous snake could result in death or serious injury. Up to 95% of snake bites occur in either tropical or developing countries. Those who live in South Asia, Southeast Asia and Sub-Saharan Africa are particularly affected by venomous snake bites, as they often don't have access to adequate healthcare services or antivenoms. Snake bites are also especially common in poor communities, often in rural areas. But those that are venomous include the rattlesnake, water moccasin, coral snake and copperhead snake. If you're bitten by a snake, your symptoms will differ depending on which type of bite it is. If you suffer a dry snake bite, you'll likely just have swelling and redness around the area of the bite. But if you're bitten by a venomous snake, you'll have more widespread symptoms, which commonly include bite marks on your skin. You may also feel pain all the way up whichever limb was affected, such as in the groin for a bite on the leg or the armpit for a bite on the arm. For example, a bite from a coral snake can be almost painless at first, but still deadly. Redness, swelling and tissue damage, or complete destruction, in the area of the bite. If you have an allergic reaction to a snake bite, you could suffer from anaphylactic shock. Their venom is mainly neurotoxic, but it can also harm body tissue or blood cells. Keep the area of the bite below the heart in order to slow the spread of venom through the bloodstream. Moving around a lot will cause the venom to spread faster through the body. This type of bandage should be tightly wrapped around the bite. While these are all useful precautionary measures, the ultimate treatment for a snake bite is antivenom. Try to get the victim of the bite antivenom as quick as possible. Knowing the size, color and shape of the snake can help your doctor determine which antivenom is best for that particular situation. A snake bite can cause people to panic and act irrationally. Even so, there are certain things you should avoid doing immediately following a snake bite, including, don't pick up the snake or try to wrap it up or kill it, as this will increase your chance of getting bitten again. Don't take any pain-relieving medication, such as ibuprofen, Advil, acetaminophen. In most cases, you'll need to stay in the hospital for at least 24 hours, so that doctors can monitor your blood pressure and overall health. If your blood pressure dips below a certain level, you may need 4 fluids, through a needle in the arm. Since antivenom has potential side effects, you'll also need to be monitored. The amount of time it takes to completely recover depends on the kind of snake bite. In most cases, children can recover from a bite from an adder in 1 to 2 weeks. Pain and swelling are common long-lasting effects in the area of the body where the bite occurred. But if you're going to be in snake territory, there are some useful tips to avoid getting bitten. Always be careful where you put your hands and feet. Don't lie down or sit down in areas where there might be snakes. Do not attempt to capture, handle or keep venomous snakes.